Hello, I'm Neetu Annie Simon, the editor of this newsletter. In this issue, Dr. Jothydev is going to talk about food care and diabetes. Now over to the presentation. Enjoy.
Hello again. Welcome to the February 2010 edition of JDC Diabetes Gems. Diabetes is a very complex disorder which culminates in a multitude of devastating complications if not treated properly in the initial 5 to 10 years when it remains silent without producing significant symptoms. This month, in this video edition, I will be discussing food care in diabetes. It is estimated that once in every 30 seconds, one leg is being amputated because of diabetes. You can imagine the depth of agony and the economic loss and the long duration of hospital stays associated with this condition. In our hospital at Jothydev Diabetes and Research Center in Trivandrum, India, we have more than 4 investigations exclusively for early screening of food disease in all diabetes patients enrolled under intensive diabetes care, which includes monofilament test, biothiometer, Doppler and Podia scan. What are the basic situations which can lead on to food disease? One is damage to the nerves because of high levels of blood sugar for a long period of time, which results in neuropathy. Neuropathic symptoms results in numbness, and the patient might even complain of excruciating pain, usually a burning sensation, which can even keep them awake throughout the night. Blood vessel damage due to blood sugars and high blood pressure and high lipids can lead on to vasculopathy, resulting in foot ulcers which doesn't heal. What are the basic food care to be taken care of in all diabetes patients? Number 1, clean the food with warm water. Always test the temperature of the water before dipping it, because if there is numbness of the extremities, loss of temperature sensation, it can lead on to devastating ulcers and other complications. What are the basic food care lessons to be learned by all diabetes patients? Number 1, clean your feet daily with lukewarm water. Make sure that the area is dry before going to sleep. Number 2, with the help of a mirror, find out whether there are any cracks or callus or any other small injuries under the foot. If so, consult your doctor immediately. Don't treat calluses by yourself without consulting the diabetologist. The reason being, calluses or in other words, thickening of the skin underneath the foot can later lead on to diabetic ulcers, and if the blood sugars are very high, treatment of this thickened skin can result in more serious complications and ulcers which doesn't heal. And the next one, when you are cutting the nails, be very careful and cut like this, not the edges. If so, it can result in ingrowing toenails and resultant injuries. And if there is a requirement, always get the help of a podiatrist. And if you realize that you have a burning sensation or numbness of the extremities, make sure that you discuss with your diabetes treatment team, which will include your diabetologist and the diabetes nurse and the educator, the team will help you a lot on how to use a diabetic footwear how to use socks, it should be loose when going to sleep, etc. etc. And one take-home message, initiation of insulin in diabetes management should be much earlier in the natural history of diabetes. If you start insulin late, then already neuropathy could have set in. And next time when you visit your diabetes treatment team, you can request them for a detailed foot examination so that it will provide us a screening procedure for the total prevention and avoidance of food complications in future. Our website is www.jothydev.net. Thank you. See you next month. Bye.